Hi, I'm Vicki Lowe. Welcome to Your Senior Center. I'm really excited to let you know that we are going to have a new segment of our show called Health Beat with our public health nurse, Maureen Cardarelli. Welcome, Maureen.
Good morning.
Thanks for being here. Can you tell us a little bit? I don't think everyone realizes that Foxborough has a public health nurse. Can you talk a little bit about, just briefly, about how that works?
So I'm employed by Community VNA in Attleboro, and we are under contract with the Foxborough Board of Health to provide the public health nursing services, and that includes things like infectious disease surveillance, reportable, things that are reportable to the state I follow up on. I do some health promotion, which is your blood pressure clinics, cholesterol screenings, glucose screenings, some health education, and now I'm drawing the blank.
Flu clinic?
Immunization, thank you. All of your immunizations that are provided by the state, including the public flu clinics.
Yeah. So you're very well known to us. You've been doing our blood pressure clinics for years. And for us, you're our expert in the field of health. So today's show, we're going to focus on Lyme disease, because that is something, as people are getting outside and gardening and doing things, they have a higher risk of exposure. Can you tell us a little bit about what Lyme disease is?
Lyme disease is an infection caused by a bacteria, and it was identified in 1975 in an area called Lyme, Connecticut. There were a couple of neighboring towns where they had higher than usual incidence of juvenile arthritis, and they discovered that the common factors for those particular cases of juvenile arthritis were that the children had had a rash, and they also identified that they had all had a tick bite. So those things being in common, the researchers started looking at it, and one doctor in particular, who the bacteria is named after, identified the specific bacteria that causes this illness.
So when someone gets Lyme disease, it's always from a tick bite, correct?
It is always from a tick bite, and a particular tick called the deer tick is the tick that's known to carry that germ, although they do carry other germs. Today we're just going to talk about the Lyme germ.
So can you tell us about, we all have been familiar with ticks for years and years, but the deer tick is kind of a different species of tick.
Right. This is a deer tick, or it's sometimes called the black-legged tick, or they also, in different parts of the country, have a western black-legged tick. So here we have dog ticks, which are kind of a larger tick, and I have some pictures that I can show that the camera can focus in on. At adult stage, a dog tick and a deer tick are about the same size. The particular stage, and I'm going to show this picture first, there are 4 stages of the life cycle of the deer tick. They start off as larvae. When they're hatched, they hatch in the leaf litter. And the larvae are going to feed once, and then they're going to drop off of the host, and they're going to molt into a nymph, and that happens in the fall. So that anytime the temperature is above 45 degrees, those become active. So we think of it as more of a summer thing, but actually in the really cool days of fall and spring, ticks are out there.
So it's really just not a winter disease.
Right. So I'm going to hold up the pictures. There are 4. They're very hard to see. The arrow is pointing to the nymphal stage tick, and that particular stage is the one that presents the most risk to humans. So the way their life cycle goes, and the other thing I'll point out is that of those 4, you have a larvae, a nymph, and an adult deer tick, and then next to it is the dog tick. As you can see, it's a little bit bigger.
Yeah.
But in that nymphal stage, that tick is about the size of a poppy seed with legs. So the reason why we see a lot of cases in people who have never had a tick bite or no known tick bite is that they are so small you could mistake it for a little piece of dirt, and it could actually feed on you for a while before you even realize that it's there, and in that process it can transmit the germ to a human.
So they're the highest, they're the ones that present the highest risk, that tiny
to
nymph?
Humans, yep. So the larvae, when they are hatched, they are not infective. They don't have the germ in them when they are not born but hatched. So they're going to feed once in their life cycle, and usually it's going to be on some kind of a little forest creature. So they're hatched in leaf litter. So if you walking through the woods, a mouse might walk by it, it'll grab onto the mouse, feed on the mouse, then it's going to drop off and molt. Once it's fully fed, it'll molt into the nymph. So if the animal that it fed on for its first feed had the Lyme germ, then when it molts into a nymph, it would be infective to humans. And at that stage, it's more likely to feed on a human, although, it would feed on anything warm-blooded that happens past it, birds, rodents, deer. And so if you were to have a bite from a nymphal stage tick that was infective, then it can transmit that germ to you.
So it's really that the tick gets the Lyme disease
from
or
an
bacteria
animal.
from an animal, and it's not just a deer. I mean, you think of it as deer tick, and you see deers around your yard, and you're nervous that you'd be at a higher risk of having them around. But it really could be from a mouse or any other animal that has
the Lyme. The estimate, the most recent information, I got most of my information off of the American Lyme Disease Foundation website. They believe that about 25% of nymphal stage ticks have the germ in them. Deer actually don't carry Lyme, but they carry ticks.
The ticks, yeah.
And I've seen pictures where their ears are covered with ticks that are feeding on them. It's pretty actually upsetting to see. They're kind of gross.
Yeah.
So later on we'll talk a little bit about prevention, and some of the projects that they've undertaken have been to try to prevent Lyme in mice and try to prevent it in deer. And so again, I'm going to repeat that the nymphal stage is the one that's the highest risk to humans, mostly because the adult ticks are bigger and we would be more aware of their presence on our body than we would of a nymphal, because they're just so small. Yeah. So I have had plenty of cases over the years where, when we do the investigation, you learn that the person was not aware they had a bite, and most likely it's because it was the tiny little nymphal stage tick that bit them.
So you said about 25% of the animals that the tick is feeding from have Lyme. So does that
25% of the nymphal stage ticks carry Lyme?
Yeah. So that means 75% of the time you might not get the disease.
If you're lucky enough to have been bit by a tick that didn't have it, you certainly wouldn't get it. So not every tick bite leads to Lyme disease, and whether it's a deer tick or a dog tick, I personally can't tell the difference by looking at them, although I've looked at a million of these pictures. When you think of it as being a black-legged tick, you think that you would know, but once they're engorged, it's just a little, it almost looks like a old brown wrinkled up grape with legs, and I don't know how to tell the difference. Working in a pediatric office for years, people used to bring in the tick, and I'm not an entomologist. I can't tell you whether it's a deer tick or a dog tick. And just because you had a tick bite, again, does not mean that you became infected with the germ. And there was a practice years ago of giving antibiotics to anybody who came in and said, I had a tick bite. But that's not necessarily good practice. That can lead to some antibiotic resistance over time. So we really want to be sparing with antibiotics, only give them when people need them. And so what we're going to do is watch for symptoms.
What are the symptoms of?
So the symptoms of Lyme disease, early symptoms of Lyme disease, we would start with, and it can be at the site of a bite or elsewhere on the body, something that's called a bullseye rash. The technical name for it is erythema migrans. And what it is it's a rash that's getting bigger and bigger and bigger and bigger, anywhere from about 2 centimeters all the way up to 2 feet. I've seen people whose entire abdomen is covered with this rash.
Wow.
I do have a picture. Actually, this one I think is clearer. And what happens is the center of the bite, as you can see, is red. And then they have an area of what's called central clearing around it, so that skin that does not look affected by a rash. And then surrounding that is another big red ring. This one happens to be a pretty large, I think I'm holding it upside down, it may be somebody's arm. But it's pretty typical of the way a Lyme rash looks, and they get bigger over time. So if somebody noticed that they had a little red patch with a little red ring around it, that would be enough to make a diagnosis. So if you knew that you had a tick bite and you're watching the area and start to notice a little bullseye rash, then the next step is to go to the doctors and say, I had a tick bite, I have a bullseye rash, and the doctor should treat for Lyme disease based on the appearance of the rash.
Now, when you get a tick bite sometimes and you remove the tick, you'll have a little red raised little thing, but it's really the bullseye rash that you're looking for, or is it any rash?
Exactly.
Just the bullseye?
It would be, for a Lyme disease, the classic rash is the bullseye, and probably up to 80% of cases start with a rash. So there are going to be that 20% of people that get no rash, or it's in an area that you can't see. It could be on your back, it could be on your scalp, and you didn't see it if you didn't know that you had a bite. So for anybody that sees that kind of rash on their body, certainly that is the first early symptom of Lyme. But there are other symptoms to watch for, and those would include what I call the summer flu. So for some people, they'll have some swollen lymph glands near the tick bite, generalized achiness, a headache, and then as time progresses, they'll develop more symptoms. They may have 2 or more rashes that are not at the same site of the bite, and that's just the germ underneath the skin wreaking its havoc. Migrating pains in the joints or tendons, and what that means is one day your knee might be sore, the next day the knee is fine, but your ankle is sore. The next day it's the other knee. So over time, people will come in and say, I've been having these joint pains, but it's not really localized to one place. It's here, it's there. That should be a clue to a provider that it may be Lyme disease. Again, a headache, stiff aching neck, facial palsy, which people have heard of Bell's palsy. It's not classic Bell's if it's Lyme, it's a facial palsy. It's one side of the face will droop. There have been cases when both sides of the face will droop. So when somebody comes in with a drooping facial, it's very obvious. You wake up in the morning and that should be a key to the provider to be checking for Lyme disease. Some people will experience numbness and tingling in their hands and feet, several enlarged lymph glands. Some people will have some cardiac symptoms, abnormal pulse rates, or either sore throats, vision changes, fever up to 102, severe fatigue. Some people will complain of pain. So arthritis, later stages, arthritis in the joints, painful swelling in the joints, disabling neurological disorders, and they kind of call mental fog, inability to concentrate, confusion, dizziness, short-term memory changes. Again, first we said tingling in the hands and feet, but at the later stage, some numbness in the hands, legs, or feet. So all of those things, when you think about fever up to 102, body aches, headache, summer flu. When I hear somebody come in at, in the middle of July and say, I have this fever, I have body aches, I'm thinking Lyme disease. Not to say that viruses don't go around during the summer that cause those symptoms, but because our lifestyles are more active outdoors, we, like you said, hiking, gardening, just about anywhere you go out there where there's woods and leaf litter, we can encounter ticks. And so when I hear someone in the middle of the summer having those flu-like symptoms, I'm thinking more Lyme than flu.
So the symptoms sound pretty severe. Does the physician just look at what your symptoms are and decide to treat you, or is there a blood test they can do or other types of tests before you have symptoms that are that severe?
There are tests that will show the antibody, and it is not necessarily going to become positive until you've had the exposure for about 30 to 60 days. So sometimes when people come in with symptoms that are suggestive of Lyme, the doctor will go ahead and treat presumptively because they know that if they do the blood test in the very early stages, it's not going to come up positive. So there are some of them that will say, come back in a few weeks and we will test you to confirm the diagnosis. And there are some that'll just say, you know what, I think that's what it is, let's treat, and if you don't get better, then we'll investigate further. So, I mean, I think it varies from provider to provider, but, you know, knowing that it's pretty prevalent in this area, you know, it is wise for people to have that kind of on their radar to be thinking about when they come up with these symptoms.
What is the treatment?
The treatment is antibiotics, and often it'll be administered for at least 3 weeks. There are times when it's longer. And, for example, I heard somebody was telling a story yesterday about how they had Lyme disease in the past. They work in landscaping, so the exposure is high. And the doctor decided to go ahead and treat presumptively because he had had a tick bite on the back of his leg, but also gave an extra refill to the prescription because the likelihood of another exposure later in the summer is pretty high. So again, anytime the temperature is over 45 degrees, ticks are active. So for somebody who works out there in the leaf litter, you know, their job is to do that. Their risk of exposure is pretty high. So to save them the trouble of coming back and forth to the doctors, you know, this doctor decided that it would be prudent to you know, preventatively have them available if he needed to go for the refill.
So even though this person had Lyme disease, he could be exposed a second time and doesn't have the antibodies to fight that off, he would need to be treated again. You can get it multiple times?
You can get it more than one time, yeah. Unfortunately, it's, yeah, I know. It would be nice if it couldn't, but unfortunately you can.
What are the ways people like that are working outside or just people who are hiking, how do you protect yourself? Like I've heard things about protective clothing
yes, absolutely.
Insect, you know, whatever.
Yep.
What do you do?
So, there's a long list of things that we can do, and the you know, short answer is insect repellents and other protective measures. So insect repellents, they're not for everybody. There are some, you know, for example, children, you want to be very careful on what you apply to children's skin. But there are some of them that you can apply to clothing, and then there are some of them that are able to be applied to exposed skin. The most important thing with any kind of an insect repellent is to read the directions on the particular product so that you don't misuse it. You don't want to put something on your skin that's supposed to go on the clothing, and you just want to make sure that, you know, for parents, check with the pediatrician, ask them what concentrations they recommend of the certain. So, for example, one of the products is DEET, D-E-E-T. Don't ask me to pronounce the long name, but there are different concentrations, anywhere from, I think, 7% all the way up to 100%. And it could be that you don't want to put 100% DEET on a small child, but for somebody who is an adult and works in landscaping, that's probably their preferred product. The other thing that is one of the recommendations is if you're going to be, you know, hiking or doing gardening, being out in the woods, then you would want to wear protective clothing. Now, there are clothing that they sell that are infused with insect repellent products. You know, if you don't have that kind of clothing, certainly wearing a long shirt or long pants and tucking those pants into the socks. The reason for that is that you're likely, and also light colored clothing, you're more likely to see a tick. So, you know, the tick's going to grab onto your ankle, and if you're wearing sneakers and socks and shorts, that thing is going to climb up your leg and find a spot to bite you. But if you have your pants tucked into your socks, then it's going to be climbing up your pants leg looking for an area of bare skin to try to grab onto. So the likelihood is you're going to see it and brush it off before it actually gets to an area where there's bare skin. Or if you're with friends or family, they're going to see that you have a tick and they'll brush the tick off of you. So those kind of preventative measures. Now, you know, I'm one that says, geez, in the heat of summer, do I want to wear long sleeves? Maybe not, but maybe that day I would use some insect repellent on my exposed skin. And then, you know, we could watch each other's back. If you see a tick on me, give it a flick. If I see one on you, I'll give it a flick. The other thing that you want to do, having been outdoors, you know, gardening or hiking or camping, is at the end of every day, you know, most of us like to go in after a hot day and take a shower, so you're going to be basically inspecting every inch of your body because you're going to feel whether there's a tick attached to you, but really do an inspection of a person from head to toe. So that means if you have small children, you're kind of doing a total body tick check on, feeling through their scalp to make sure there's nothing attached to their scalp, looking in the creases and all the areas that they prefer. They like to kind of gravitate toward a warm, quiet area, so they do like creases and behind the knees and in the fold of between the leg and the body. So just checking a person over. Having said that, if you have pets, you want to check your dog or your cat from head to toe as well. I do it every day with my dog from the time the temp hits about 45, and get right in there into the thick fur. They have that thick fur around their neck. Get right in there every day. I'm always checking him. He thinks he's getting affection. It's fine with me, but I'm making sure that not only is he not going to develop Lyme from a tick bite, but that tick that may be hanging onto his fur isn't going to crawl off of him and crawl onto me and bite me. So pretty thoroughly every day, total body tick checks for everybody in the house that's warm-blooded.
And I know there are products like Frontline that you can put on your dog and everything, but to me, my dog has Frontline, and she'll come in and I'll still find ticks on her. Yes. And it's like they find the dog to ride in on, and then they find something better.
Exactly.
It seems.
Yeah, which is why
they're pretty efficient at finding.
They really
food.
are. Yep. The larvae and the nymphs, again, they're in the leaf litter. So if when you take the dog for the walk, as their feet flip through the leaves, they're going to just start. They're going to grab onto the fur, and then they're going to climb their way up. But the adult ticks actually hang out in the grass, and I somewhere had a picture but decided not to show that today. But you can even look this up online, and they have this nice little picture of a tick, and its leg is hanging onto a blade of grass, and the other leg is like this, and as soon as something brushes past it, it grabs on, and then it's going to climb up and find a nice place to hide and bite. So.
Are there other things we can do to prevent it? is there, I know that there are products that you can spray on your lawn that are for different types of insects. Is that effective on ticks, do you know?
Yes, chemicals certainly do. If you want to avoid chemicals, there are mechanical measures that you can use. One would be to keep the leaf litter down. So, if you want to keep your lawn nice and trim. And if you have woods at the edge of your property, the recommendation is a border of either wood chips or gravel around the edge so that they're not crawling from the woods out into your lawn. And sprays and all those things. I'm more of a naturalist. I don't really want to put all that stuff out there. We have turtles and birds and everything, right. So I don't want to be using a lot of chemicals. Or even just your dog walking on the lawn. Exactly, the dog walking on the lawn, the runoff that goes into the water that we drink. So I'm more for the mechanical, keeping the lawn nicely mowed and, doing a border. And we don't, I'm not going to, it's, who has money to go out and buy gravel to edge their lawn? If you do, great, go ahead and do it. And if you don't, then you want to just keep that lawn nice and trimmed. And keep that in mind, that if you decide to go for that walk into the woods, and even if you don't, really be checking for ticks regularly.
Now, have you seen a lot of cases of Lyme disease recently? It's June now. Is this around the time that people start coming in with those types of complaints?
Pretty much, it's out there. Yeah, there's lots of it, and I don't think there are many of us that don't know anybody who's ever had it. Or, I spoke in a room full of people, and I asked, is there anybody here who's never had a tick bite? Those kind of things. Pretty much, most of us have experienced either someone who has been diagnosed, or it's pretty common, unfortunately. More so for people who spend a lot of time outdoors. But even if we don't, people have cats, they let their cats out, the cat brings in ticks. A person who really doesn't spend a lot of time, hiking, camping, gardening, could still get Lyme disease because the cat brought a tick into the house. So again, those products that they recommend for pets, Frontline or Advantix, I think is one of the other ones, definitely you want to use them. Some of the vets say use them year-round. Some of them say just do it when the temperature's above 45. So pretty much from early spring through late fall, and checking them regularly.
Now, I had heard years back that there was a vaccine for Lyme disease, but that it wasn't that effective. Do you have any information about that? We hadn't talked about it before, but I wasn't sure. And
I do remember actually one at the office that I worked in, we did give it. It was, for some reason, not really well received, but I think that at the time there was talk about there being some pretty significant side effects and not a whole lot of interest in it. And I think it's a shame, because I think if they reintroduced it now, a lot of people would be rolling up their sleeve looking to get that vaccine.
Yeah.
But that being said, there is an animal version of a Lyme vaccine, and so dogs, I don't know about cats, but I know that my dog gets it every year, and he gets a booster every year. And my vet happens to test them for Lyme every year. My dog will be 10 in October, and we were told that it's unusual. This was at the time it was in a Plymouth vet that said it's unusual. Most of our dogs have had it at least once. So our dog, I just had him tested again last week, and it was negative.
And that's
at
the blood
almost
test
10 years
the same
old.
that humans
So
have?
it's a blood test. Yeah, I don't know actually what version of it
right.
they
No, that's
use,
okay.
but yeah. So I mean, if you can have your pet vaccinated, that may be helpful to the pet, because you know, they aren't able to tell us, I have a headache or a stiff neck. What happens with them is they just simply become lame. So one day the dog can't walk.
Yeah.
And you know, it's a shame to have them get to that point.
Yeah. Well, that was very informative. Do you have any other things that you'd like
thank
to
you.
talk about Lyme disease?
Well,
Or?
let me just check my... one thing that I didn't mention about symptoms, and I do think it's important to know that untreated, that it can lead to some cardiac problems and some other really significant things that, you know, eye inflammation, and again, the neurological symptoms. So I think it's really important to know that. Untreated, it can wreak some havoc and cause some permanent heart damage. So it is important to, if you
I actually
think that
heard
you
of a
may
woman
have
that
it.
had gotten a tick bite on her head, and it was before Lyme disease was really was well known, and she developed some very significant neurological problems with they attributed to the Lyme disease. So it is
And it can
something that
be
if anyone
permanent.
has any question, or like you say, feel like they have that summer flu, that they should seek medical attention to try to
Absolutely.
get it treated as quickly as possible.
Absolutely. So one other thing that I want to talk about with prevention is how to remove a tick properly.
Oh, good.
And that I also have pictures of. I have the wrong way and the right way. So the right way, well, I have two pictures. Let's see if they both show up. I like the very pointed tweezer, where you get right in there and you attach the tweezer as close to the skin as you can grasp that tick, and you're going to pull straight up. I'm going to move the picture now. So you're going to pull straight up so that the skin tense, and then hold on to that tick. It should let go. It may take a while. So if you have a screaming 2-year-old, it's a little harder. If you just keep pulling, you're going to pull the mouth. Two things could happen: pull off a chunk of skin, or the mouth parts break off from the bug and stay in the wound, which you don't really want to see that happen. But that's the best way to do it. This is the wrong way to do it. You don't want to grab the tick by the body, because then you're squeezing and you could actually introduce some of those germs into the wound if they haven't been transmitted yet. So again, you want to grasp as close to the skin as you can get, so that you're actually those mouth parts are kind of hard. It feels almost feels like there's a little piece of metal or something in there. It's actually like a bony plate, the mouth part. And then you're just going to grab it, pull until the tick lets go. After you remove the tick, wash with soap and water. Write it on the calendar, remove tick. So under today's date, June 18th, you would write tick removed. And then for the next month, you're going to be watching for symptoms. So if you develop a fever, if you develop fatigue, body aches, then you're going to go and say, geez, it was June 18th that I got bit. And you're going to go to your doctor and say, I had a tick bite on June 18th. I'm feeling really lousy. And the doctor can consider the possibility of Lyme and whether or not to treat based on the information that you've given them. So for about 4 to 6 weeks after a bite, you'd want to watch for symptoms.
That's a really good tip. And I've realized that I've removed ticks the wrong way. Even though I've gotten very close to the mouth, I really yank it out instead of just letting the tick release. And one time I did leave a mouth part in my body.
Yeah.
which wasn't very pleasant.
And then any opening in the skin can get infected. That's just a normal thing. Whenever you have a scrape, the possibility for infection. So, if you have a foreign body in there, like the mouth part, your body is going to reject that, and you could get a little infection from that. And again, if it's a little screaming 2-year-old, you don't want to be digging in there trying to remove mouth parts.
Right.
So just have a little patience with that.
Great tip. Well,
there we have it.
This has been wonderful. Thank you. And
My
as you can
pleasure.
see, Maureen is our health expert, and I thank you for tuning in, and I thank Maureen for coming. And
Thank you
we
very
look
much
forward
for
to
having me.
more segments of Health Beat.
And if anybody has any questions, please feel free to call me anytime.
Great. Thank you for coming.
Thank you for
That was
having me.
very good.